We will be beginning in about 3 minutes. We will be beginning in about 2 minutes.
Good afternoon. This is Tracy Aaron with the Lake Cumberland District Health Department. We are having our weekly update. Today is July the 29th regarding COVID-19 across the Lake Cumberland District. We have some members of our executive team that are here today that's going to be answering questions you all have shared over the last week. I'm going to turn it over to Mr. Sean Crabtree right now, Executive Director, who can share with us some updates maybe last week.
Tracy, you are cutting in and out a little bit.
Okay.
I think we got the most of it, so you can jump into questions.
Do you want to give us an update from the previous week, Sean?
All right. So I'll give you a profile view while I look at our situation board. In Adair County, we've had 198 total cases. 19 of those are deceased, 157 recovered. We have 22 current active cases in Adair. One of those hospitalized, 22 isolated. In Casey County, we've had 159 total cases, 9 deceased, 94 recovered, 56 presently active. Of those, 55 are home isolated, 1 is in the hospital. We've had 21 total cases in Clinton, no deaths, 14 recovered, 7 active, all home isolated. 37 total cases in Cumberland, 0 deaths, 20 recovered, 17 active. Of those active cases, 17 are home isolated, or all of them are. 30 total cases in Green, 1 deceased, 26 recovered, with 3 currently active cases, all on home isolation. In Macquarie, 28 cases, 0 deaths, 20 recovered, 7 active cases, and all of those are on home isolation. In Pulaski, we've had a total of 248 cases, 2 deaths, 184 recovered. We have 62 active cases right now in Pulaski. Of those, 59 are home isolated and 3 are in the hospital. We have 99 cases in Russell County, 5 of those deceased, 77 recovered, leaving 17 current active cases, all on home isolation. Taylor County, 95 total cases, 1 death, 71 recovered, leaving 17 active cases, all on home isolation. 95 total cases for Taylor, 1 deceased, 71 recovered, leaving 23 active cases, 20 isolated, 3 in the hospital. 51 total cases for Wayne, 0 deaths, 38 recovered, 13 active cases in Wayne right now, all on home isolation, for a district-wide total of 966 total cases, 37 deaths, 702 recovered, 227 presently active, 219 of those on home isolation, 8 in the hospital. I was looking at today's numbers after we did our daily disposition calls. I think our hospitalization number is up to 10 now. So far today, it looks like we're going to be adding about 22 new cases plus whatever comes in the remainder of the day. Currently, we have 1 case to add in Adair, 6 in Casey, 2 in Clinton, 2 in Greene, 1 in Macquarie, 8 in Pulaski, 1 in Wayne, and 1 in Cumberland. And of course, that can change. Sometimes we find out a case may belong to another county, or there may be more cases that come in throughout the day, but that's where today's looking at so far. So interesting developments this week. We were notified that the Cabinet of Health and Family Services has adopted an emergency regulation under existing law. The Department for Public Health and the Cabinet of Health and Family Services has the authority to adopt emergency regulations. Apparently that has happened, and the health departments are going to be granted the authority to issue citations or fines to businesses that are out of compliance with the governor's orders. We haven't saw the details of all of this yet, but I assume the details will be coming in a few days. It's certainly not our goal to want to cite anyone. We would prefer, just if we get a complaint, to call the business, speak to them, encourage them to comply, and that they comply voluntarily. And you know, if they insist on being non-compliant, I suppose we will go the route of, you know, issuing the fines and so forth. My understanding is there's 3 or 4 levels of fining before you would be turned over to the Department of Labor to consider a closure order. So that's where things stand today. If that holds up, I guess we'll know in a few days if that's going to happen. So anyway, that's in the works. We did have a cluster of COVID-19 cases in our Casey County Health Department. That's not particularly surprising. Healthcare workers place themselves in environments where they could potentially be exposed frequently. It's unfortunate. It's unfortunate it's happened to us internally, but we do see cases of healthcare facilities all across the district, so it does get into healthcare facilities too. It just goes to show you that even in environments that are hyper vigilant about observing the guidance, there is still risk. Wearing your face mask or your face covering, keeping your distance reduces the risk, but it doesn't eliminate the risk. So it shows you that this disease can spread easily, even in environments where people are being very cautious. So we really encourage you, be cautious, because if you're not being cautious, it can spread all the quicker. So that's kind of where we are for the week. We closed the Casey County Health Department for a week just to give, make sure that any staff that doesn't have it weren't going to catch it, and to sanitize the building, and we'll return to business Monday in Casey County. So you all have anything to add to that, Dr. Lehman, Stewart? All right, so I'll turn that back over then to Tracy to start the questions, and I do see we're starting to get some in the chat box too, so keep a look on that, watch on that. Okay.
I will. And I want to remind everyone also, if you're out there watching, that you can put questions in the chat box. So please do that as we walk through. The first question is going to be for you, Sean. With the number of cases going up a little in Macquarie County over the past few days, Are the cases related as in families? Can you hear me at all, Sean?
Oh, yes, I'm hearing you. You're sounding good.
Are the cases related as in families or community spread? And then what is community spread and what determines community spread?
Well, my definition of community spread may be different than Dr. Wayman's, so she can add a more medical answer if she wants to. My answer for community spread is more or less it's when you can't determine from where people are contracting the virus because it's spreading freely in the public. Just means that it's spreading freely out in the community. Recent cases in Macquarie County, I looked when I saw this question. Cases that are active right now are one is tied to travel, one is tied to a church, one is tied to a prison, the federal prison there. One is a family tie. One is unknown, and two was still under investigation when I pulled up the data. So that's the breakdown of where we're seeing the ties to those.
Okay, thank you, Sean. And I think that there's a question which you probably just answered on YouTube Live, and it asked about Macquarie County's numbers and the increase, and were any of those related to the federal prison facility there? So I think you just answered that one.
So, yeah, one was tied to the federal prison. Those cases get reported, and they get recorded in the county because, that's where the person's residence is for the moment. Of course, with the federal prison, we're not really that involved with the response. The federal prison handles the response themselves. So hopefully we won't see a big flare up in the federal prison there like we have in some other federal prisons in the state.
Okay. Next question. There has been a possible rumor a possible rumor has it that the virus has popped up in a local church. Any truth to that? And if so, what is the degree of spread for that?
Right now in Macquarie County, one of the cases is tied to a local church. For our total district, we've had 13% of our active cases have had some tie to a place of worship. And of our total cases, 13.1% has had some tie to a place of worship. So places of worship, every day it changes a little bit, but it's usually either our second or third highest situation that we see cases tied to, depending on what's going on that day and that week. Generally, though, places of worship cause for us quite a bit of work because there's usually a lot of exposure when we have a place of worship. I can say that, and now we've had so many churches that's had at least one case. I don't know the details as well as I did a couple of weeks ago. But I can say largely, when we've seen clusters in a place of worship, it's been at places of worship that weren't observing the guidance, meaning they weren't enforcing strictly the social distancing and the wearing of the face coverings. And largely the churches that are following the guidance doesn't see a cluster. Now, what do I mean by cluster? If there's going to be one case that shows up in a lot of places because somebody picked it up somewhere. But if they've gone to church or gone to work and they don't spread it to anyone because the work or the church is using the guidance and it doesn't get spread, then it's not a cluster. If it gets spread and you get two or more cases tied back to one location like a church or a business, it would be called a cluster. So we do see clusters happen in places that are observing the guidance, but we see a whole lot more clusters in places that are not. So while you can have a cluster in a place that's observing the guidance, it sure does help to be observing the guidance.
Thank you. Next question. What does it mean when a case has been released?
When a case is considered no longer contagious, they can be released from isolation. The criteria for this are that 10 days should have passed since the onset of symptoms, or testing if the patient is asymptomatic, and the case has not had a fever for at least 24 hours, and the symptoms are improving.
And do you want to just remind everyone what asymptomatic means?
Means they don't have any symptoms. So you can be positive, but you may not have symptoms at all throughout your 10 days.
Okay, thank you, Dr. Lemon. Next question. How do our numbers get adjusted when you receive a false positive?
Well, it is very difficult to ascertain if a positive is actually a false positive, as people can be positive and be asymptomatic, that is, they don't have any symptoms. However, if we deem that a test is a false positive, they are not counted at the very beginning, so we do not have to adjust anything.
Okay, thank you again. Next question. And I'm assuming they're talking about the reports that are published, Sean, that we put out. It says, where it says still symptomatic, does that mean that the patient has been tested positive before and now they are retested while still symptomatic? And if so, is the second positive test listed as a new case?
No, duplicate testing does not get reported, and still symptomatic means that when we start our investigation, that they are still symptomatic, as their onset is often a few days before that.
That's exactly right. Yeah, the report I do, each day we list all of the new cases and whether they're symptomatic, asymptomatic, or whether they've been released, meaning they were, tested through testing means that, tested and maybe they were positive several weeks ago. But Dr. Raymond is right. The way the report pulls in, it just lists whether the cases that are new are asymptomatic or symptomatic. We started including that because there was a lot of questions in the community saying, a lot of people saying, you've got this thing. Most of the people who have it don't have any symptoms. And we wanted to, start demonstrating to the public, that most of the people that have it do have symptoms. So we started recording that number.
Next question. If most of the population wears a mask, when would we see a positive effect of those on the curve?
Somewhere between 14 and 28 days. That's 1 to 2 incubation periods.
So they mandated the mask, Sean, what, a week ago?
Yeah, and sometimes to see a statistically significant difference, it may even take a couple of more cycles. And what do I mean by that is, if I'm out and I get infected and I infect 2 other people, it's going to take me maybe about a week to start showing symptoms, and it may take them a week after that. But then the 2 people that each of them infect, that turns into 4 more cases, and that may be another week away, and then it turns into 8 another week away. So, it starts making a statistical difference, something we can really see that jumps out in the numbers, sometimes 3 and 4 or even 5 weeks away. So it depends on how you want to look at that question. We see immediate impacts on these things on a very small scale. When do we see a statistically noticeable difference? Sometimes it's 3 or 4 or 5 weeks away. So the mask mandate has been in place long enough now where we should start seeing if it's making a difference. So
providing 95% of people wear them.
Providing people are wearing them, yes. Well, at whatever level people are wearing them, we will see if it's making a difference. So certainly we wish people in mass would wear the face coverings, because we believe that is the best chance of slowing the spread right now. I know the governor every day is considering additional restrictions, and I'm not one that wants to go back to everything being shut down. I would just really like to see everyone avoid crowds as much as you can. When you have to be around people, keep your 6-foot distance and wear a face covering when you're out, whether you're around one person or within 6 feet of people or not. Just get in the habit of wearing it. Sanitize, wash your hands, do those things too, but avoid the crowds and wear the face covering. it's a minor inconvenience, but certainly don't want to see the economy shut down again.
Okay. Who are the oldest and youngest positive cases, or what? Who are the oldest and youngest positive cases in our district? The ages there.
One of our nursing home patients at one point, she was 103 and tested positive, and our youngest so far has been 2 months. So anywhere from 2 months of age to 103, which tells you it's not sparing anyone. Of course, the older you are, the more high risk you are of it having a more severe impact. But certainly the younger people can have it and spread it. At least that's what we think. The information changes on this disease as it's studied and understood better. The information's changing daily and weekly, but we're telling you each week, what we understand based on the best scientific evidence we have that day.
Okay. The next question I think is for you, Stuart. Are businesses, stores, nail salons, etc., operating at 100% capacity now?
No, not according to the guidance. Retail stores and nail salons are at 50% occupational or space capacity. So I think for the nail salons, it's at 50% occupational, and the stores, it's the 50% space capacity.
Yeah. So we also, even at 50% capacity, they still have to meet the minimum requirements, right? So just remind everyone what the minimum requirements are in addition to those location-specific rules.
So the minimum requirements that the business has to meet is that they have to do daily temperature checks. They're going to do a daily screening for symptoms.
Employees.
The employees, yes. They are required to wear the mask, of course. And then now patrons are required to wear the mask when they're in those stores also. So they do have to follow the minimum guidance. They have to be increasing their sanitization levels, such as at a nail salon. So after each customer, they're going to have to sanitize. And then at a retail store, they need to be very frequently doing the high-touch surfaces, like the door handles, restrooms, places like that. So.
Okay. Thank you, Stuart. Next question. If you are a contact but you are asymptomatic, should you be tested? And I think they're referring to because you may have been in contact with someone else and infected them. So, Dr. Wayman?
If you have been in contact to a case, you should be quarantined for 14 days so as not to spread the disease if you become ill. People are most contagious on the day before and the day of symptom onset. Testing is not necessary unless you become symptomatic. If, however, you choose to be tested, you must realize that a negative test only means you are negative on that day, and then tomorrow or the next day you may become positive. So quarantine is more important than the testing, but yes, you could be tested.
Next question. Does the coronavirus test specifically for COVID-19, or does it show positive for other coronaviruses?
Well, we have 3 different types of tests that are being used. The antibody test may cross-react with other coronaviruses and thus may have false positives. The nucleic acid PCR and the antigen tests are much more specific for COVID-19.
Okay, so when you said some of those, what does PCR stand for, Dr. Wayman?
Polymerase chain reaction. That basically means that they amplify the amount of nucleic acid from the virus so that it can be detected. And that is the nucleic acid of the virus, so it's pretty specific.
Okay, thank you.
Tracy, do you want to remind, we've got 55 people watching live. If they have a question, they can use the chat and type it in, and if we can, we'll answer it. Well, I guess I just reminded them, so.
Thank you for doing that.
continue.
Stuart, the next one's going to be for you. Businesses are asking for signs. Where can they get those signs at?
Okay, so they can go to the Healthy at Work, the COVID website, covid19.ky.gov, and then from there, they are able to scroll down to the Healthy at Work. At the bottom of that page, there are PDFs for signs that you can print and hang up in your establishment. We have those signs in a few different languages on the website. So if you'll just visit that, go down to the bottom of the Healthy at Work, and then you'll find the PDFs for the signs that you can print.
Good, thank you. What are the regulations for kids wearing masks in stores?
So children under 5 are going to be exempt from wearing face masks under the executive order. And CDC recommends that children under 2 not wear face masks. So they are exempt in Kentucky from 5 and under are going to be exempt from wearing the face masks in the stores. That's going to be the same when school starts. So you're going to have some kindergarten age children, they're going to be exempt, but the first grade age children, generally who are the 6-year-olds, they're going to have to wear the masks. Now there may be a little bit of a trick coming into, you may have some kids held back that start kindergarten late, but that is the age group for the children wearing masks. But I will say this, if your child can tolerate the mask, and most of them can, and most of them actually, if you get them a nice little mask that they like and it's fun and they like to be like their mom and dad, we've just seen a 2-month-old has COVID in our district or has had. So children are not immune to this, even though it may not affect them as much. So if they can wear a mask, they should.
Okay. Next question. Can someone who has had COVID get it again?
There have been a few documented cases in China of a second infection many months after the first one, but we have not seen that locally. It is possible, as studies have shown, that the levels of antibodies decrease over a 3-month period after the recovery, but we don't have enough data to really say that you can or cannot at this time.
I noticed, Dr. Wayman, there was a question about the PCR test, the nasal swab.
Yes, it is a nasal swab, as is the antigen test.
Next question. Since Tennessee is border state to several of our counties, are Tennessee residents allowed to get tested here in our counties, I guess?
My assumption is that anyone that schedules an office visit at any medical provider can get whatever medical services they need while they're at that visit. I know in these border counties, some Kentuckians travel to Tennessee for their groceries or medical services, and some Tennesseans travel to Kentucky, depending on what's the closest town, for their medical services or groceries or repair services or whatever. So I'm assuming that, yes, you can schedule an appointment and get whatever service that they offer that you need.
But if they're found to be positive, they're not reported as Kentucky numbers.
They reported positive in their wherever they reside.
Where can I find an updated list of testing sites or where I can get tested?
At the same place that Stuart was talking about to find the link to the signage on the Kentucky COVID-19 website. If you go to their homepage, it's just, there's an introductory paragraph, and then the next section on that website is by county, and there's a map too. You can click by county which doctor's offices are presently doing the testing. Now, what kind of tests they provide and those kinds of things, you'll just have to check around. Places run out of tests, places change the types of testing that they do. They don't tell us that, and we can't keep up with that. But I would start there by going to the Kentucky COVID-19 site and then call around, follow whatever directions that they give you when you check in with them on the phone.
Next question has to do with churches. Stuart, this one's for you. My question is about mask while in church. We are in our 60s and we go to a large church. We haven't been going because people aren't wearing masks. Aren't people supposed to be wearing the mask? Isn't social distancing required at churches too, especially in the seating? And how can this be done? How can this be addressed so they do? We miss not going to church, but feel it isn't safe to go to church because they aren't complying with the guidelines.
Okay, so let me start out by saying there is guidance, and the answer to those questions is yes. On the Healthy at Work website that we talked about there, which is a link off the covid19.ky.gov, you'll find guidance related to churches. So the churches are supposed to be by the guidance. This is the guidance for the religious places of worship. Need to limit the attendance to 50% of the building capacity. Of course, wear the face mask and social distance. Now, there's not really a way for the health department to police churches, of course. So to address that, what we're trying to do is we just try to keep pushing our message out to avoid large crowds, to wear a mask, to wash your hands frequently. And remember earlier, Sean was talking about the clusters that we've had associated with churches. So we've had several clusters associated with churches, several people that became sick and isolated, several people that were quarantined because they were contacts of that sick person or the positive person. And as you know, the past 2 weeks, so last week and this week, the governor has actually asked for churches to not hold in-person services since our cases are spiking up so high. So the safest way to have church right now, the most safe way is virtual. And then beyond that, then if you could have outside services where you can distance from each other. So that's going to be, not to say that there's not risk involved in coming to an outside service, but it's much, it's a safer, less risky than going in, especially if people aren't observing the guidance of wearing the masks and socially distancing. In those cases, again, we just see churches that churches are a place that the virus can spread very easy.
And as a church member, as a valued member of your church, speak to your church leadership about your concerns. And, always remember, people are just people, whether it's church or a business or whatever. Some people are going to agree with your being more cautious, and some people are not going to agree. And try to be loving and try to be forgiving. And if you feel like you need to stay home to be safe, stay home to be safe. So that was the last question, Tracy, I think. Do you have any more?
I do not have any more.
Okay, so I will give any one. We've got 64 people watching live. If you want to type something in, now would be the time. The YouTube Live is about 20 seconds behind our actual presentation here. So I'm going to stall for a few seconds while I'm waiting to see if any other questions come in. I will say that, the guidance that we've been giving from the beginning about avoiding crowds as much as you can, social distancing, wearing a face covering, sanitizing, washing your hands, those things are still the most important things to slow the spread. And our public can be our biggest asset in this regard, or they can certainly be our biggest liability. We see situations all across our district where there are certain places that are largely in compliance, where you go into stores and, largely in compliance. And then we see pictures of places that are extremely out of compliance. And, it's up to each citizen to make a decision about, what you're going to do and what you're going to be comfortable with. And just encourage you all to follow the guidance. We know there's going to be a certain percentage of the people that are active at any given time who are going to require hospitalization. So, we don't want to see our medical communities or hospitals overwhelmed. Dr. Wayman, have you heard any feedback about, someone was asking me the other day, this wasn't one of the questions, are the labs still giving a good turnaround time on their tests, or is that the lab capacity starting to fall?
Some of the labs are pretty quick, and others it's still taking 5 to 7 days. So
yeah,
we have a range.
So, that may mean that the medical infrastructure is starting to become overwhelmed, meaning that there's so many people now that have it and people that are afraid they've been exposed that a lot of people are going and trying to get tested. And, can you get in for your appointment quickly? When you get your lab, how quick do you get the results back? If the labs are becoming overwhelmed and it's taking 4 to 7 days to get the results back, that certainly doesn't lend itself to much of a public health response. Because by the time we found out the test was positive, you would have already become active and spread it, and the people you spread it to would probably already be spreading it. So it works best when you're tested and the test comes back quick, and we can reach out to your close contacts before they become contagious and get them quarantined. That's how the contact tracing improves the situation. So, that's a sign to me that the medical infrastructure is already being taxed. Now, of course, the hospital right now, we have ICU beds and ventilators available, I think, statewide. From day to day, it's in the 70, 65, 75% of the ICU beds being occupied. We want to watch that number daily. We, don't want to see that getting up into 85, 90%. That's when you're starting to get really in a scary situation. Judge Craig says, we joined the meeting late. Are there any updates on the 127 yard sale? Stuart, I give that one to you.
Yes, no, sir, Judge. There's not really been any updates that we've had. As far as we know, the event is going to go on. Of course, it should follow the minimum requirements, the social distancing, wearing a mask. But we also know that this yard sale, the 127 yard sale, it's not something that is as organized. I mean, just people who live up and down 127 that they're having yard sales and all this stuff. The sad thing is there's no way that the health department, with the amount of staff that we have, that especially our environmental staff, we have maybe 10 people for 10 counties, can go out and police something like the yard sale that runs through 3 of our counties in our district. And it's so much and so, so many people. And of course, you've been there, I'm sure, many years through many yard sales that you can't even hardly drove down the road and just these little off the way places that they set up and doing things like that. I mean, it's just impossible to police something like that. So, our plea with the community in Russell County, in Casey County, in Cumberland County is please, if you're going to go to the 127 yard sale, don't get up in a bunch of big crowd of people. Be sure and wear your mask. Be sure and wash your hands. Take some hand sanitizer with you when you're out there and you're looking at the different items that the yard sale would have. Just be very, very careful. Unfortunately, I know that a lot of, there's been questions about decreasing the amount of people in restaurants, or then closing the bars, and some venues where lots of people gather together are still going on, and of course that's guidance that's beyond the health department's control. We're not consulted on what guidance comes out. They don't call us and normally ask us. So we have to use the guidance that we have, and we want to be safe doing it.
The restaurant, if it's inside dining, you're inside in an enclosed space with a group of people for a length of time.
Right, yeah.
If you're in a bar, there's even more close mingling. Generally speaking, that's what goes on in a bar, or so I've been told. Not that I've ever been to a bar. I have been to a bar, by the way. Not frequently, but I'm just going to get deeper the more I try to answer that. Churches, too, you're inside a facility for an extended period of time with a group of people. My point is, crowds don't just happen. Crowds happen because people gather. If you're an individual citizen, and I don't care if it's a yard sale, Dollar General, church, whatever, when you roll up and you see a crowd, you do not have to get out and walk up and join the crowd. Crowds don't just happen instantly. So, avoid those situations. Crowds don't have to happen at the yard sale. Crowds don't have to happen at the Dollar General or at the restaurant. Crowds happen because people choose to crowd together. And as I said, when you're in the middle of a pandemic, it's not a good time to choose to crowd together. So, as citizens, use good judgment in this regard.
And as far as the situations with the bar and the restaurant, I think, the White House has looked at this, of course, I'm sure with CDC, and they've seen direct links from places like restaurants and bars that even links to long-term care facilities when people are, employees are out and somebody gets the virus, somebody is pre-symptomatic, so they don't know that they're sick yet, but they're shedding the virus, and then they're around their family member, and that family member may work in the long-term care facility. So that's how these things get spread and just keep getting bigger and bigger and bigger.
All right.
Tracy, I think that's it if you want to sign us off.
I want to say thank you all for joining today. Remember what Mr. Crabtree and Dr. Wayman and Stewart has said in regards to avoiding crowds. Be sure to wear your mask, social distance, sanitize regularly. We will be back next week, same time, Wednesday at 2 o'clock. If you have questions, I encourage you to send those our way. Thank you all. Have a good day.
Thank you all for joining in.